So when we look at obesity, the link between obesity and fertility, we know that obese women have a 3-time higher risk of infertility, have irregular cycles associated with oligo and ovulation, and the probability of pregnancy is reduced by 5% for every BMI unit greater than 29. Another thing we're seeing is that obesity can be multifactorial, as we know, and it could be the main secondary accompanying cause of infertility. We know a high prevalence of the obese population requires assisted reproductive techniques. And we also know that the ability to deliver good care to patients is limited by their body habits, such as transvaginal ultrasounds, and again, anesthetic-related concerns. So obesity can impair both reproduction in both men and women, leading to infertility in couples trying to conceive and subsequently complications in their pregnancy. As we know, obesity has a lot of associated comorbidities, including polycystic ovarian disease, which is one of the best studied. Infertility is associated with conditions, as we know, such as type 2 diabetes, metabolic syndrome, PCOS. And these conditions are all marked by obesity and a complex metabolic phenotype that include hyperinsulinemia, high leptin levels with high insulin and leptin resistance. Again, of these metabolic disorders of infertility, PCOS is the best characterized as the most common cause of infertility in women who are obese. In addition to obesity and hyperinsulinemia, PCOS is associated with anovulation, elevated LH levels, as well as a suggestion that these higher elevated LH levels are associated with a tonically, kind of chronically active reproductive center, leading to ovarian dysfunction. How about female sexual scores in terms of function and satisfaction? What we know is obese and overweight women have a higher index of dysfunction in desire, arousal, sexual satisfaction, as well compared to normal weight women. I think when we think of infertility, we always think of women, but obesity is known to affect both women and men, as other speakers alluded to infertility. Men are affected by obesity with increased scrotal temperature and testicular temperatures, which can affect spermatogenesis. We see impairment in sperm structure as well as quality, as well as peripheral vascular disease leading to erectile dysfunction.